Good afternoon, sir. Please introduce yourself and tell us about your organization.
Good afternoon, Christine. My name is Deon Baisako. I'm a married man of 3 children. I'm a volunteer, Secretary General for the Namibia Mental Health Association, an NGO which is struggling financially but is visible in the community in the sense that we are offering some winter soup at the center itself. But why did I become interested in this association? It's because when I became mentally ill in 2004, it was a long way, but I was still employed by the government. And there was no peer support. And this illness was so stigmatized by then, even up to now, that you really feel rejected and not having some, there was just no last resort or safe havens where you can just go and express yourself and be among people facing the same fate. So this association was established in 2005 by service providers alone, and it was dormant until 2010, and they regrouped again, but due to funds they could not function. And in 2015 they got a funding from World Health Organization on the prerequisite that there must be service providers on board, service users on board, I mean. And we were called in, but we were just in the line waiting for our medicine, and we were spotted there by the treasurer then of the association, Ms. Magdalena Tidalelua, and we joined the AGM and we were elected as facilitators to facilitate our peer support groups. It's where I really see the importance of having people around you who are facing the same dilemma like as you are. So we encourage ourselves, motivated ourselves, and said that no, this illness is just the same as a physical illness. It's only that now it's a mental illness because it's treated with medication, of therapy, and vaccines. The same way the physical illnesses are being treated. But in the way, before 2015, I was already medically boarded in 2010. So in the meantime, you have to fill up to gap years. So while I was at Soldier, I was already doing literacy job as a part-time job. But it was full-time because I was contracted by Ministry of Education under the Directorate of Lifelong Learning. So when I lost my job, or when I was medically boarded, I continued being a literacy promoter from 2012 because I skipped 2011. Yeah, then it's a long history. So I started the job 2012 again for literacy promoter while I was already medically boarded. In 2015, really, I saw the seriousness of joining this association when I was approached, and I climbed the ladder from facilitator to vice president, and now currently volunteer secretary general, and it's passion that has driven me to do this job. And it's an impact felt in the community because wherever they see me, they see hope. They see that it's a treatable condition. He lost his job, he get married, he's still having children, he's active. So why not us also with the same illnesses? We can also do the same. So I draw motivation from there. I draw motivation from God. That is for all of us, and it does not discriminate anyone.
So you are providing a very important service to people living with a mental health issue, isn't it?
Mental health is not an issue.
No, it's an illness.
It's issues that are affecting mental health.
Okay.
That is
Sorry.
what
Yes.
why are you not saying physical issues, physical health issues?
No. Yeah.
That's the terminology that we have to change also. Mental health is a good thing, it's a health. It's very good.
Yes.
But there are issues that are affecting mental health.
Okay.
The same way there are issues affecting physical health.
Yes.
If you don't exercise, you will get diabetes, for instance, for physical health. That's an issue that will affect you. The same way, issues that can affect mental illness is overthinking, depression. If you overthink, not depression yet, worrying and overthinking, those are two issues that can affect your mental health that can lead into an illness.
Yeah, thank you so much for this clarification. Can you tell me the service you are providing? What are they? So if people come to you, what can you offer, or what can they offer? Because it's a two-way communication sometimes, isn't it?
Yes. Thank you for the question. It's a very good question. Currently, without sponsor, without funds, you cannot operate. And we don't have funding from any donor agency. We are dormant, so to say. But we have to thank the National Disability Council, who intervened in the dysfunctional National Federation of Persons with Disabilities to assist us, to meet us halfway of some sort of funding, so that we can at least provide that soup at the center. Otherwise, our hands would have been cut off because we are not collecting any registration fee from our members. We first have to formulate the database. We don't know to whom we are speaking. So through this intervention, we are getting at least a data, so that we can know how many members we have and to whom we are really speaking. Because it's a voluntary registration, we don't force anybody to register to our association.
So, what in concrete then can you offer?
What we really offer is the support group meetings.
Okay.
It's like a counseling session where we are inviting the students.
Okay.
Who are doing internships at our association, and they really help us facilitating our groups, so that each and every one can have a chance to speak about his challenges, either of the relatives, either of the service providers, either with what he is having personally.
But I also understand that you personally are an advocate to raise, for instance, my awareness and my knowledge about people having a mental health disease. Do you call it a disease? A mental health disturbance?
People with mental illnesses.
Okay, so you go to meetings and you raise awareness, don't you?
Yes.
Yes. Because there's lots of stereotypes still.
Yes.
And
we have high-level meetings where, for instance, the National Disability Forum, where we meet with all the owners, offices, ministries and agencies and academics, where we bring out all issues concerning disabilities. And since we are now with the UNDP, United Nations program on the rights of persons with disabilities, aligning that one also, program also with this Sustainable Development Goals. It comes at the time that we are now, it looks like we are now competing with the physical disabled people. And we are always now, looks like we are at the last loop of the chain. But the good thing is that we feel a sense of belonging, we feel a sense of acceptance, we feel a sense of tolerance when we are there. It's no more the way we were seen before, that no, even if they say something, just ignore. Maybe they're just talking it out of hallucinations or some sort of things that they used to label us before. So there's an impact. Now mental illness they see that there's no blanket that they can cover and say that an adherent mentally ill person is the same like a non-adherent mentally ill person. At least there's a difference now. That if you are adherent, means you take your medication on time, you are cooperative of your relatives and your service provider, and you look after your personal development. You dress clean, you enroll at institutions and studies, so that you can also bring bread on the table, because you lost your job and now you have to start somewhere so that you can also provide bread again.
Yes.
So that's the impact.
Yeah, and I also think, you know, with mental illness, I mean, we all can come in situations where we just we can't handle it, and then it can lead to depression or grief, and then it might then become chronic and become a mental illness. And then it's of course great to know that you do the work you are doing, because
Yes.
one day we might need your support.
Yes.
So we wish you all the very best for yourself, your family. I've heard you are a father, you have children, you have a wife. That's wonderful. And all the best for you and your peer groups. Thank you so much for your time.